Hello, my name is Dr. Dewan S. Raja. Today I will discuss about iron deficiency anemia. Iron deficiency anemia is a common type of anemia. And according to World Health Organization, this is the most common type of anemia that occurs when the body lacks sufficient iron to produce an adequate amount of hemoglobin. Hemoglobin is a protein in red blood cells that enables them to carry oxygen to the body's tissues. Iron is an essential mineral that plays a crucial role in various bodily functions, including the production of hemoglobin. What is anemia? Anemia is a condition of reduced number of red blood cells or erythrocytes or a lower than normal level of hemoglobin in the blood, leading to a decrease in the oxygen carrying capacity of the blood. So if there is lack of hemoglobin synthesis due to lack of iron, we will get iron deficiency anemia that will decrease the oxygen carrying capacity of the blood, so our body tissues, our vital organ will not get sufficient amount of oxygen. The prevalence of iron deficiency anemia in the United States is 2% in adult men, 9 to 12% in non-Hispanic white women, and 20% Black and Mexican American women. But this statistics is different from country to country. Suppose in the Indian subcontinent country like Bangladesh, India, there are much more percentage of population are suffering from iron deficiency anemia because in those countries some parasitic diseases are very common, like that of the hookworm, even the malaria, kalajor, they all causes anemia. So the prevalence is variable from country to country, even it is different among the people of different races in the same country. It also depends on the age, personal hygiene. What are the causes of iron deficiency anemia? Okay. Inadequate dietary intake, not consuming enough iron-rich foods such as red meat, poultry, fish, bean, lentils, tofu, and fortified cereals. Okay. Poor iron absorption, certain conditions such as celiac disease, inflammatory bowel disease like Crohn's disease, ulcerative colitis, even peptic ulcer can interfere with the absorption of iron from the gastrointestinal tract. Blood loss, chronic blood loss, hookworm infestation caused by Ankylostoma duodenale or Nicator americanus, either due to gastrointestinal bleeding, ulcer, colorectal polyp, etc. Hookworm actually bite on the intestinal mucosa. It also prevents absorption. It covers the absorptive surface and it causes leaking of blood from the gastrointestinal system. Other worm, like a roundworm, they also block the surface for absorption of iron. So not only hookworm, other worm can also cause anemia. Menstrual bleeding, there may be hemorrhagia, especially heavy period, that is menorrhagia, can lead to depletion of iron stores. increased iron requirement. This can occur during periods of rapid growth, pregnancy, or breastfeeding. Impaired iron utilization. Some medical conditions like certain chronic diseases can interfere with the body's ability to use iron properly. Okay, we got that. Now we'll go to the symptoms and signs of iron deficiency anemia. Okay, fatigue, lack of energy, always tired, shortness of breath because oxygen carrying capacity is less. So the lung try to compensate. So there will be increased respiratory rate. Weakness, overall weakness because lack of oxygen to the tissue, lack of activity. Therefore, that will lead to weakness. Headache, again, the central nervous system don't get adequate amount of oxygen. So there will be headache. And there will be restless leg syndrome. Typically at night, there will be cramping in the calf muscles. Okay. Poor focus. Again, lack of oxygen going to the brain. That may lead to less amount of blood going to the brain. Heart palpitation. Again, this is due to the lack of oxygen carrying capacity of the blood. That will cause heart to compensate by increasing the heart rate. And another symptom, we'll add this pica. This image I have taken from Google, but very well. Okay, so pica, another condition, some people may develop altered food taste, especially during pregnancy. They like to eat like that of the mud or icy substance. This is a sign of iron deficiency anemia. Okay, because by different variety of food they may get some of the iron sources. Koilonychia, this is the condition of the nail, flattened nail. Even a few drop of water may be placed here. Okay, koilonychia, this is the sign of iron deficiency anemia. So this is the histopathology, the peripheral blood smear. We are seeing what? Pale RBC. Okay, hemoglobin is lacking. Hemoglobin is just at the periphery. It should be cover most of the part. It is biconcave, but still the entire part, the circular part, is lacking oxygen. Okay, we got that. Now if we go to again, these are all pale cells. They have less amount of hemoglobin. Okay, some platelet. We can get some platelet here. This is a white blood cell. We will not count that. And the RDW is much more. One cell is different from the other cell in the width. Okay, we got that. And we'll get microcytic, small size RBC less than 7.2 micron. Microcytic hypochromic, hemoglobin is less, so MCH will be less. Okay, we are seeing in this image some of the normal RBC here, because this person, according to this description, got blood transfusion. These are the normal blood cell, but this is certainly anemic blood cell. These are all anemic blood cells. Okay. So differential diagnosis: anemia of chronic disease, sideroblastic anemia, thalassemia trait, lead poisoning. Okay, with the lead poisoning we'll get basophilic stippling. Okay, and lead poisoning we can take the X-ray of the bone. We may get the imaging of the heavy metal. Okay, thalassemia, sideroblastic anemia, iron cannot be metabolized properly. Okay, anemia of chronic disease, body cannot use the iron in chronic disease. Okay, so these are the differential diagnosis. We'll go to the lab diagnosis. Complete blood count will get low hemoglobin, maybe 7, 8, 9 or 10 milligram percent. Low mean corpuscular volume, less than 90 micron. Increased RDW, red blood cell diameter width. Okay, so this will be more than 15%. Red blood cell distribution width RDW, that will be more than 15%. Low hematocrit, maybe around 25, 30. Peripheral blood smear shows microcytic hypochromic RBC. Microcytic, that means its size is less. Hypochromic means that less amount of hemoglobin. Decreased serum ferritin, but this is important. Increased total iron binding capacity, that is called TIBC. It will be high here. Treatment of iron deficiency anemia. Treatment typically involves addressing the underlying cause and may include dietary changes. Underlying cause: a person has adenomatous polyp in the colon, person has hemorrhoid or peptic ulcer, that should be managed first. A woman has menorrhagia or adolescent girl has menorrhagia, then in that condition that should be addressed properly. Okay, so addressing the underlying cause, dietary changes, consuming iron rich food, iron supplement, and in some cases medical procedures to control bleeding like polypectomy, repair of peptic ulcer, repair of the hemorrhoid or piles. Okay, anti-helminthic will give one eye here. Okay, anti-helminthic. Okay, anti-helminthic to get rid of hookworms. Okay, we can also get rid of other worms. Okay, helminths from the intestine, and certainly health education. This is very important. And that's all about the iron deficiency anemia. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.